Good afternoon. My name is Stanislas Barro and I'm the Global Head of Anti-Counterfeiting at Novartis, a worldwide leading pharmaceutical company. In January this year, the World Health Organization announced that tackling the issue of substandard and falsified medicines should be a priority focus area in the years to come to address the urgent global health challenge of expanding access to quality medicines. While the world is facing a global pandemic impacting our families, friends, and colleagues, protecting infected patients and healthcare professionals from the risk of falsified medicines has never been so important. Yet, the current shortages of medical products, such as masks, hydroalcoholic gels, testing kits, and promising news about possible treatments will undoubtedly be exploited by criminal organizations in total disregard of patient safety considerations or the fact that these are critical times for everyone. On the contrary, criminals will see this as a fantastic opportunity to maximize their profit, and we should expect an increase in various forms of illicit trade of medical products: counterfeiting, theft, tampering, and illegal diversion. Criminals are known to be opportunistic, agile, and very reactive. In fact, US law enforcement already reported a seizure of fake COVID-19 testing kits, which led to an arrest over the weekend in the UK by law enforcement. And this is just the beginning. We, as a community of public-private experts on illicit trade, have a role to play to support our communities, employers, and governments in this extreme situation. That is doing everything we can to guarantee that only genuine, high-quality medical products and treatments reach patients and healthcare practitioners timely. And time is of the essence. Once again, OECD and EUIPO have produced a powerful tool to help policymakers better understand the nature and scale of illicit trade. And we are proud and grateful that OECD invited us to join its expert panel in the preparation of this report. This report provides an urgent and compelling argument for governments to step up enforcement against illicit pharmaceuticals. It reminds us all that pharmaceuticals is a very special category when it comes to illicit trade. Not only it impacts the economy, it also seriously harms and kills patients, often the most vulnerable ones. This report also completes and reinforces the recent Trade report measuring the impact of illicit trade on the United Nations Sustainable Development Goals. All in all, we all draw the same conclusions. Falsified medicines impact good health and well-being. The vast majority of falsified medicines we have come across and tested, over 90%, would seriously harm or kill patients. The main reason being that they either do not contain active ingredient or the incorrect one, or worse, they contain harmful chemicals. It is also clear that critical therapeutic areas such as oncology, cardiovascular, anti-infectives are deeply impacted. Falsified medicines impact the society with respect to jobs, government revenues, research, innovations to find new cures. Falsified medicines dramatically increase inequalities, especially in low-middle income countries, hence seriously hindering our ambition to reduce inequalities. And falsified medicines also compromise our efforts to achieve more responsible consumption and production levels. Each year, enormous amounts of falsified medicines are being destroyed in pure waste. So the scale of these seizures leaves no doubt about who we are against. Organized crime, who identified how to greatly optimize its profit at the expense of public health. As an example, the recent EUIPO Veribus operation led to the dismantlement of 17 criminal organizations. So as an actor from the private sector, Novartis is fully committed to play its role and do what it can to combat the plague of falsified medicines. We hold ourselves accountable each year in our annual report called Novartis in Society. I invite you to read the 2019 report to learn more about progresses we have made in relation to intelligence, such as online-offline monitoring, prevention with tools to accelerate detection, enforcement by supporting law enforcement and health authorities, and stakeholder engagements to foster more effective public-private partnership. This report notably clarifies that our activities and counterfeiting activities are overseen at the company's executive committee level. It is actively supported by 15 functions across the company. It is part of the company's risk strategy and marked as an emerging risk, which triggers robust risk mitigation activities. We're also significantly expanding our resources in the areas of regional investigations, forensics, and governance. And we have significantly invested in data and digital technologies to try to overcome some of the biggest challenges we are faced with, notably local detection and authentication of falsified medicines. So where do we go from here? Our conviction is that we need to build on such qualitative study from a broader set of objectives. First, by encouraging the OECD to now move to policy recommendations, sharing best practices and focusing on effective public-private partnerships. We need to equip ourselves with suitable regulations, cooperation frameworks and resources, but also political will to have a meaningful and deterrent impact on this criminal activity. Success will come through collective action. We should fully leverage the mandate of the task force, which is to design and promote good practices in public policies as a means to reduce and deter trafficking and smuggling activities, and to map policies and practices and develop metrics on the governance gaps to foster illicit trade to enable cross-country comparisons. Secondly, also by fully capturing the World Health Organization definition of falsified medicines, which refers to every medicines or so-called medicines lying about its identity, composition, or source. So in essence, it captures counterfeiting, theft, tampering, and even illegal diversion. They all correspond to illicit trade activities harming patients and the economy, and I strongly believe we should refer to these going forward. With this, I thank you for your attention.